name is Dr. Stephen Taylor. I'm a psychiatrist, and I've been asked to discuss depression and talk a little bit about how we as psychiatrists classify and understand mental disorders like depression. Psychiatrists use a manual called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM for short, as a way to standardize and understand mental illnesses so that psychiatrists from across the country and around the globe can discuss depression and diagnose depression in a uniform and standardized way, and that we can make meaningful discussions about depression and other mental illnesses as well. Depression is a mental illness that is often misunderstood and misused in common parlance, which is to say that sometimes people will say, "I feel depressed," or "I feel blue," when they're really just having a bad day and not necessarily suffering from clinical depression. Let's watch together this intake interview with Ellen as she talks to her new psychiatrist. Getting to know each other, they discuss Ellen's past and a little bit about her depression and see if we can understand something about how depression affects people and how we can understand the illness itself.
Hi, Ellen. I'm Dr. Vincent. It's nice to meet you.
Hello, Dr. Vincent.
So, can you tell me a little bit about what brought you here today?
I have depression.
I see. All right. Well, go ahead.
For as long as I can remember, I've had depression.
Well, do you remember the first time you ever suffered from depression?
When I was a teenager. Oh, back then we didn't even call it depression. I just thought I was sick or something.
Can you remember what it felt like?
I was tired all the time. I wasn't sleeping. I had no appetite. I started spending a lot of time alone. I isolated myself from my friends and family.
That must have felt pretty awful.
It did. No one in my family ever talked about their feelings, so I just felt like I was weird or something.
Oh, that must have felt really lonely. How long did you feel that way?
About a year, I guess.
Okay.
I didn't even call it depression until I tried to kill myself.
Oh, Ellen, I'm so sorry. That must have been really difficult. Well, can you talk a little bit about what happened next?
Well, when I was in the hospital, I saw a doctor, and he told me I had depression. So he gave me some medications, and I began to feel better after that.
Well, do you remember the medication?
Oh, no, that was a long time ago.
I see. So, did the depression ever come back?
Not for a long time. After my son was born, I started feeling some depression, and so I called my doctor and told her the symptoms, and she put me on Prozac.
I see. Good. Okay, how long ago was this?
Let's see. My son is 22 now, so it's been about that long.
I see. Well, and did that medication help?
Oh, yeah. I'm still on the medications today. I haven't had depression since.
Very good.
So what does this interview tell us about depression? One thing we see when Ellen was talking with Dr. Vincent, she mentions that she first had depression when she was a teenager. It's very common for depression to present itself at a young age, oftentimes in our teen years. If you remember, Ellen was talking about depression and saying that she didn't really understand what was happening to her, or that she didn't even think it was depression until, unfortunately, she tried to take her own life. Too often that happens to young people when they suffer from depression initially. They don't understand the symptoms and they don't know what's happening until something really bad happens, like they attempt suicide. Maybe we can talk a little bit about the symptoms of depression now and see if we can understand together what we might be looking for. If you can remember this mnemonic, SIGI caps, then you'll have it. S stands for sleep. People with depression often have a difficult time with sleep. Remember, Ellen was telling us that she wasn't sleeping very well. People who have depression will often wake up early and then have trouble falling back to sleep. I stands for interest. People who suffer from depression will often have a difficult time maintaining interest in activities, and they'll often become more isolated, separate themselves from their families, and lose pleasure in activities. They'll sometimes even stop doing things that they ordinarily enjoy doing because they have depression. They've begun to have a diminished capacity to enjoy things. G stands for guilt. People suffering from depression often feel guilty, as if the problems of the world are their fault. They'll often feel that They're a burden on their families and a burden on society. And this guilt can even make them feel that things that aren't even possibly their fault are because of something they've done. E, as we move down our list, stands for energy. Patients who have depression will often have decreased energy. They have a difficult time moving around. They have a hard time finishing activities or completing tasks during the day. They often find themselves feeling worn down and tired by the end of the day. As we move down our list now, our next letter is C. C stands for concentration. Patients with depression have a difficult time with focus, concentration. They have a difficult time with their memory. It's not unusual for people who suffer from depression to have a difficult time with their short-term memory, even maintaining focus and concentration while having a conversation with a friend or even watching a television program. As we move down, we've done S, I, G, and E, and we've done C for concentration. We now move down to A. A stands for appetite. Patients suffering from depression will often lose their appetite. Again, it's not unusual for people suffering from depression to lose weight because they've stopped eating. And when they do eat, food will often lose its flavor. The next letter down is P. P is a little more subjective. P stands for psychomotor activity. Patients with depression will often describe having a feeling or a sense that they're moving very slowly and that it's difficult to physically move, as if they're wading through a swimming pool or walking through quicksand. And if you observe a person with depression, oftentimes they physically are moving slower. It takes them longer to move. It takes them longer to complete activities. S at the end stands for suicide. Suicidal thoughts are very common in depression. It's something we need to be aware of, and it's also something that we need to not be afraid to talk about with people. It's important that if somebody has depression and they're having suicidal thoughts, that we know this so that we can be of more help to them. It wasn't until Ellen became suicidal that she even sought treatment or got help. Luckily for her, she lived and she is doing well now. However, that doesn't always happen. So suicide and suicidal thoughts are something that are very important for us to understand. Well, I hope this discussion about depression has given you some insight into some of the symptoms and some of the features that we know as clinical depression. I guess I would say in conclusion that it's important that we understand that these are symptoms of depression, but it's also a time-dependent illness, which is to say people don't just have these symptoms for one day and we say they're depressed. They have to have them for time. So if a person has these symptoms for a period of 2 weeks or more, then we can diagnose them as having major depression or depression. Again, if this happens to someone you know, or if it even happens to you, it's very important to do what Ellen did and seek out help and not wait until something terrible happens, like someone tries to kill themselves, before we realize that there's a problem and try to help them. Well, thank you for taking your time to watch this, and I hope that this has been helpful. Thank you very much.